Hello there, my name's Alan Ashley, although I'm usually known as Ash, and sometimes I'm known as Jnanakava, and I'm going to be the meditation teacher on the Careful Mind program. So the way the program came about is that DJ Brown and I were talking about compassion in the health service and discussing this whole business about it having been recognised that there not being enough compassion, the need for more compassion in healthcare. But how do you do that? How do you even talk about it? How do you make sense of what that means? And given my Buddhist background, well, the Buddhist tradition has 2,500 years of making sense of compassion. That was a very useful way of talking about it, and also of actively cultivating compassion, so working to develop it. And because compassion is just a general human quality, then you don't need to be a Buddhist to do it. It's something that anybody can do, and you can take out of Buddhism the whole business of cultivating compassion through meditation, in the same way that mindfulness meditation has been taken out of Buddhism without necessarily bringing Buddhism with it. And now, of course, mindfulness is all over the NHS. It's really useful in a whole range of different ways, and week by week articles are published explaining the ways in which it benefits people. And that's great. That's great. 20 years ago, if you'd told me that there'd be adverts on bus stops for mindfulness, I'd have been delighted. It's a great development. So, but we thought that the mindfulness wasn't the whole deal really, and if we could start to look at developing compassion, then that could support people who work in healthcare, whether clinically or as managers, just to do your job better really, to have a better experience of working, and to be able to work with the people who have to go through the whole business of being treated. So that's the plan, and in the next little video I'll tell you a little bit about how the sessions will work.